Good day everyone, my name is David and today I'll be discussing and demonstrating care for patients with TPN. What is TPN? TPN is an acronym that denotes the word Total Parenteral Nutrition. TPN can be defined as a technique or method in which concentrated nutrients are introduced into the bloodstream via a large vein. In most cases, the subclavian vein. Now, TPN is also known as hyperalimentation. Hyperalimentation means hyper, above the digestive or the alimentary tract. Now, who needs TPN? Or we talk about indications for TPN. Now, certain people who have bowel disorders or whose bowels need complete rest can use TPN, or certain people who have stomach disorders, certain people who are sick, ill, or injured, or people who have just come out of surgery, especially gastrointestinal surgery. Now, TPN is different from feeding via an IV line because we have to take note of the word TPN, Total Parenteral Nutrition. The word total means the delivery of all 6 classes of food, right? So there's delivery of carbohydrates, proteins, and fats. While in feeding via an IV line, only small micromolecules can be transmitted or transported, like water, glucose molecules, vitamins, and nutrients. And the reason being is because an IV line is very small. Therefore, macromolecules cannot be transmitted into the body. But with TPN, an IV line is not used. Instead, a catheter is used. Now, a catheter is much more wider and can allow the delivery of larger molecules. Likely, it is very important to know that a nursing assistant cannot give TPN or cannot administer or set up a patient for TPN. However, a nursing assistant can care for patients who are receiving TPN. Thank you. When should care for patients with TPN be given? Care for patients with TPN should be given every day. Now we have the materials that we're going to be using for the dressing. Firstly, we have the first pair of gloves and the second pair of gloves. We have the cotton balls that we're going to be using together with the cleansing solution for the cleaning. This right here is the cleansing solution. We have the sterile gauze pad that is going to be used for the dressing. And we have the tape that we're going to use to hold down the dressing. Thank you. Good day, madam. My name is David, and I'm your nursing assistant for today. How are you doing, madam?
I'm fine, thank you.
Okay, ma'am. Ma'am, I want to ask, do you feel any pain around the site of insertion? Does it hurt in any way? Does it hurt when you move? Does it hurt even without moving?
No, I don't feel pain.
Okay, ma'am. After asking this, I'd go on to check if the tubing has become disconnected. I'd check the TPN feeding bags and bottle to see if they're empty. And if empty, I'd report this to the nurse immediately so that further action can be carried out and the empty bag can be replaced. I'd then go on to open the clothing of the patient with their consent. Is it okay, madam, if I open and take a look at it? Is that okay with you, madam?
It's okay. You can take a look.
Okay. And check if there's swelling, redness, or drainage at the site of insertion. Upon opening the clothing of this patient, I came to see that the dressing was no longer clean due to drainage from the site of insertion. So I carried out the procedures for changing of dressing of a patient. To perform good hand washing measures. After this, I then put on my gloves, which I'm already doing. I then proceed to apply some of the cleansing solution onto my cotton gauze. After this, I then loosen the tape by pulling the ends of the tape carefully and slowly. This is done to prevent complaints of pain by the patient or complaints of uncomfortability by the patient. Taking out the previous or the old dressing, I discard it or I dispose it into my plastic bag for used supplies. To take off my gloves and then discard them in the plastic bag. To wash my hands and put on a new pair of clean gloves. After this, I take the cotton gauze and I use it to gently wipe the edges of the insertion site. I wipe in a circular motion going outwards and never retracing my steps. After this, I discard the used cotton gauze in the plastic bag for used supplies. I then take one more cotton gauze and use it to clean again. After doing this for the second time, I then discard the cotton gauze in my plastic bag for used supplies. I then take my sterile gauze pad and apply it onto the insertion site, making sure not to touch or to move the tubing connecting the tubing at the insertion site. I then take my tape and then I proceed to apply my tape to secure the gauze in place. Start clothing the patient again. Thank you very much, madam, for your cooperation. Have a nice day, madam.
And you too.